Hi, I'm Dr. Sam Kelos. I'm a physical therapist specializing in the treatment of headache and migraine disorders. So today I want to talk a little bit more to clear up an important but often misunderstood distinction in migraine, the difference between causes of migraine and triggers of migraine. So these words are not interchangeable, and understanding the difference can really change the way migraine is perceived, especially for those who don't suffer from it. So what causes migraine? So migraine is a serious neurobiological disease with a strong genetic component. About approximately 60% is related to genetics. The cause lies within the hyperreactivity of the brain, where there's changes in nerves, chemicals, and blood vessels that create a cascade of events that lead to a migraine attack. Now, these reactive changes in the brain bring on the debilitating symptoms related to migraine. That includes the headache, aura, nausea, sensitivity to light and sound. This is a complex process, and it goes far beyond just a single external factor. What are migraine triggers then? So triggers, on the other hand, are factors that start a migraine attack or episode. This is already an attack that's primed to occur because of the genetic involvement. So this is like the spark that lights a fire. There's already firewood there to start it, but that spark helped to ignite that fire. Triggers can be modifiable and non-modifiable. Things like stress, fasting or dehydration, or sleep patterns are modifiable triggers, but non-modifiable triggers exist, like changes in weather or hormonal fluctuations. Triggers also vary greatly from person to person, so what might be a trigger for one individual, like red wine or bright light, could have no effect on somebody else. So why does this difference matter? So blaming triggers as the cause of migraine minimizes how significant and complex this disease really is. Saying things like, my migraine is caused by stress, or I wouldn't have had this migraine if I drank more water, really oversimplifies the reality of this disease and places blame on the individual. It's like saying that I plugged in the toaster and it caused the house's power to go out. Sure, the toaster might have been the tipping point that caused the breaker to trip, but the reality was that the electrical system couldn't handle the amount of energy the system needed. Similarly, the triggers like stress or weather changes might start a migraine attack, but the cause lies in the brain's underlying hyperreactivity. So why this language really matters. Using cause and trigger interchangeably can be harmful to those with migraine. It stigmatizes those by suggesting that they're responsible for their own attacks, and if they had just done more, it wouldn't have occurred. It also underplays the burden of this disease, which can profoundly impact their quality of life and how they interact with the world around them. So instead, we should really reframe migraine more accurately as a serious neurobiological condition caused by a combination of genetic predisposition and acquired brain reactivity. Triggers are just really a part of the migraine equation, but they don't tell the whole story. So the takeaway, that the words we use about migraine matter. So in understanding and explaining the difference between migraine cause and triggers, we can reduce the stigma and create a better understanding of this disease for those that live with it.